Hello, this is Claire OT. I'm broadcasting again from COT 2012, and yesterday I broadcast an interview with a lady called Professor Jill Chard, and I told you all that she was my favourite teacher at St Martin's, Lancaster, because she was. And I'm now going to interview my favourite teacher from York St John, who is Dr. Katrina Bannigan, who's a real expert about mental health OT and particularly evidence-based practice. So really relevant considering what we've just heard from Jennifer Creek about how important it is for us to be a little bit more outward looking in OT. And I want to extend my personal thanks as well for the fantastic pastoral support that I got from Dr. Bannigan when I was a student at York St John, and that I know she's got special hand cream in her room, and if you're feeling bad, if you're having a bad day as a student at York, I recommend Dr. Katrina Bannigan's Magic Hand Cream. You heard it here first. So just want to speak to you about evidence-based practice, really. Why
can I just say before, I'm having to compose myself because I don't think I've ever been anybody's favourite tutor, and I didn't think anybody really believed that the hand cream was magic, but it is magic hand cream. So.
It is?
Yes.
Well, I believe all sorts of nonsense, fairies, unicorns, you name it.
But I'm really glad it made a difference. Thank you. I really appreciate that.
Well, good. And I'm sure you're many people's favourite teacher, you know. Perhaps they don't tell you that because of your eminent research publication list and the fact that you're, you know, up there on a pedestal for them, a bit like Jennifer Creek, really, you know.
I'm quite in the same league as Jennifer Creek. I mean, you could be right, but also I think if you teach research methods, it has this aura about it being more difficult, and sometimes people don't find it really easy to see how it can relate to practice. But, you know, absolutely in my heart of hearts, when I'm researching or I'm trying to encourage people to do research or read research, my only motivation is practice. My only motivation is to improve the care of the people that we work with and to make sure that we're doing the best thing. But it's sometimes the leap when we know about the research practice gap, it can seem really difficult to believe that's true, but it absolutely is true.
Yeah, and I think, you know, thinking back to, you know, the classes that I took with you, you know, the stuff about research methodology and stuff, it can be quite dry. It's quite a dry topic. It's quite, you know, compared with some of the more easily accessible topics that we study, you know, it's harder to kind of, you know, really feel.
Well, I have a joke that I say to my students is I always wish I could be one of my colleagues, Lois Addy, who's absolutely superb expert in paediatrics. And when she walks into the room, people are like, oh, Lois, children, paediatrics. And obviously because she's very good. But when I walk into the room, it's like, oh no, Katrina, research. You know. So, and you're absolutely right. But you know, I get paid a very good salary to try and make it as accessible as possible and to try and ignite people's imaginations. And I think as the years go on, I learn more and more ways to try and do that. So one of the things I've been presenting at this conference is a curriculum development project that we've been doing at York St John called Learning by Example, as a way of breaking down research to make it more manageable, more accessible to students. So, and I think it's starting to make a difference.
Yeah, I mean, certainly if you look at the conference, you know, the number of students doing fantastic presentations and posters as well, you know, really, really encouraging, isn't it? Really, they're leaving the rest of us standing.
I've had the privilege of, I worked with a group of students on a project scoping mental health research across the world, and one of the students presented the paper in a massive auditorium and got over his nerves to do that, and another student was on the project came to listen, and they're just the fact that they've got the courage and the capacity to do that so early on in their careers, I just think is terribly humbling. And you know, I really have the sense that students believe you when you say you want to work with these co-researchers. They see you as part of the team and they're part of the team as well, so it's tremendous, really tremendous.
So obviously your area of interest is mental health.
Absolutely.
But your research around evidence-based practice is applicable across all the areas. Why is it important that we are making sure that we're using evidence-based practice, and why should we be doing all that extra work to contribute to the research base for the profession?
Well, the reality of the situation is, and I actually learned this lesson the hard way, is we think what we see or how we interpret things is right. So we, you know, if we hear a story of somebody saying, well, I saw this and they worked in practice, we believe it, but actually it's really only a story. It's what we call anecdotal evidence. And sometimes we read things into situations that actually aren't really there. And also, I mean, Delmar and Das wrote a really good paper where, so often people just get better of their own accord, so we don't actually know whether what we did made a difference. So with evidence-based practice, by collecting data and being really able to try and separate out what's our assumption and actually what is really there makes a huge difference. And so when I worked in health, we were very privileged to be given some money to evaluate a generic therapist post, because we had a locum who was superb, who'd worked in all different parts of the hospital, was willing to do anything, and we thought, and I thought as the researcher coming in and working on a business case, actually what we need is somebody who can go anywhere and do anything with a generic post. And so we got the money, and then the senior ones then said, no, we don't need a generic therapist. What we need is somebody to work on the medical wards with stroke. And so you kind of have that dilemma, is it the researchers so cut off they don't know what's going on the ground, or are the people on the ground so sure about things? So, but we've already been given the money at that point, so we had to evaluate the generic therapist post. Now, we collected all the data, and I put every single bit of data into the computer. We have a research system, and as I was putting the data in, I kept seeing stroke. And I thought, oh, they were right, I was wrong. So, it was a very humbling experience. And then we analysed the data, and actually, we were both wrong. Because what had happened is, between us getting the generic therapist post and then suggesting that we need stroke, they put a new story in my head. So all the data that I was picking up as I was putting it in was stroke, stroke, stroke. And I actually missed the missing link, which was actually oncology. We have this huge unmet need for people with cancer who were on medical wards that were not being met. And actually it's gone on, that study has gone on to enable us to say this is unmet need and to get a cancer service in place. A lot of that work happened after I left that post. I don't want anybody to think I'm just saying that we made that happen. But the really profound lesson that I learned from that data collection is that I have assumptions that are wrong. The people around me have assumptions that are wrong, and you have to collect data and you have to analyse it and you have to know what your assumptions are in order to be able to find out what's really going on. And that's why we need evidence-based practice, because if we don't use data that has been collected carefully, we're really in danger of doing the wrong things. Because if we'd allowed lots of money to generic therapists, or allowed lots of money to stroke, both things would be wrong, and there'd still be this huge pool of oncology patients whose needs are not being met at all. And that was just profound. So I don't know if that answers your question.
Yeah, absolutely, and it's really interesting to hear that as well, because a lot of OTs and OT students are aware of this Nicholson challenge that we face in health, where we're expecting to make 20 billion savings over the next 5 years, and the quality, innovation, productivity and practice, what's the final P, practice, of the QUIP agenda, which is now a permanent state of affairs. This is not a 5-year gimmick, this is what we're doing now in health. And so we know that we must create evidence to support what we're doing, and I've got a lot of interest in mental health, and I think that in a way in mental health, we're almost worse at it than people in other areas sometimes. And I was having a fascinating discussion, which of course didn't broadcast because the computer failed me, with the mental health specialist section yesterday about using MOHOS on entry to the service, and then as an outcome measure to prove our effectiveness, which of course has an impact on things like results and all the rest of it. Now I know that's probably your perspective is that I'm talking a dry language now, because I'm talking about stuff that excites me, which is around electronics and all of that stuff. But I think it is very important, and I was really heartened to hear that we've got procedures in place now for recording that in the electronic health record.
And I mean, it's been a huge piece of work, and obviously I think people like Dr. Elizabeth White and Chris Austin at COT are to be utterly commended for having the vision when it all first started, and to keep going with it and bringing people on board, because we did have a chuckle about this yesterday, because it is not the most. Actually, they're probably the people that have got the hardest agenda. I think I'm hard done to compared to my good colleague Lois in teaching research, but actually convincing people to collect data, to collect it well, because it will influence decisions, is really, really difficult. And people can't make that jump in the imagination quite often because they've not seen it in practice. But you're right, this agenda is not going away. And I suppose that's the other really important point about why research and evidence-based practice is important, because we are public sector workers in the UK. UK,
Yeah.
there is a limited pot of money. So if we are going to spend money, we want to spend it as wisely as possible for the greatest benefit. And when I say greatest benefit, it doesn't necessarily mean numbers, it could be in terms of money. But we need to make those decisions, and they need to be really informed decisions. People shouldn't be shooting from the hip or working from their assumptions. And to be quite honest, we really, really need to be involving service users in that. And that has been a really brilliant thing across this conference, where people have been much more mindful of, we should, well, I suppose it seems to be no decisions for us without us. We should be really doing this.
Yeah, and I was speaking to Marion Janner at Star Wars yesterday, and one of the things that we were saying was that, we've got this artificial distinction really between professionals and service users. And I said to Marion, if you take a multidisciplinary care team working with you, perhaps there's 4 members of that team. Well, one member of that team is statistically going to have a mental health issue that year. So year on year, we're not talking about these disparate groups, one of professionals and one of service users. We're very much people that pass from the perspective of a service user back to the perspective of a professional. And I think that's one of the real benefits that we can get from using online media and social media. Being able to engage with people and actually say to people, do you know what, get in touch. Tell us what your priorities are.
I did teach Claire, as she's pointed out at the beginning of this presentation. It has just been wonderful to see about the conference and seeing the impact you've had, and I'm hoping very much that after the conference you're going to start teaching me, because I do run a research centre and we've dabbled a bit with social networking, but we've not made use of it, and this has just been profound to see the impact that you're having and how you're getting people involved. So I'm just amazed. Fantastic.
Thank you. I mean, as you know, I always found it difficult to not ask questions.
She's not lying. She's not lying. And I was always willing to answer them.
Yeah, you are. So I suppose it's a case of finding a way of being comfortable. But I'm a real advocate for our profession. But I'm also very happy to take on that challenge.
Well, I feel like, having seen you about and seeing people respond to you, and yesterday when we met you and somebody went, you're Claire O.T., and that you just tweeted and she just seen it, you've made me realise that it probably is more possible. Because obviously I'm not a digital native. Well, I'm a digital immigrant, aren't I? Not a digital native. So, but I feel like you're going to be able to teach me how to integrate this better and to actually make it just something that's part of my life, rather than at the moment it feels like a huge
extra
that I've got to add on. So, and I suppose that comes back to, I've got to change in the same way that we're asking people to change in terms of data collection, to collect mobiles. But if you actually ask an occupational therapist or any allied health professional, do you think you should be demonstrating that you make a difference? They would say yes. So then you would say, well, why aren't you collecting this data? And most people haven't got an answer to that. And if often they're not, it's because they actually feel like they're not sure what's the best thing to use, why they should be using it and stuff, or how they can integrate it so that it isn't an extra. So I suppose I thought that's in a different way and stuff. So.
And I think if we look at the different forms of data as well, we've got quantitative data about what is our impact, what are our MOHO scores. But we've got the qualitative data which relates to patient experience.
Absolutely.
And what it actually feels like to be in receipt of our services. And social media is absolutely fantastic for capturing that. And if you look at organisations like Patient Opinion, who I'm another big supporter of Patient Opinion, but there are also websites like iwantgreatcare.com that does like a TripAdvisor star rating of therapists and doctors. We will expect in the future patients are going to have the choice of which provider they're actually receiving services from. And these are the kind of things that they're going to look at to decide whether or not to receive services from us. So if we can engage in that, then
as privileged as actually supervising a physiotherapy student a couple of years ago called Amy Cullen, who looked at fibromyalgia blocks and how she's a physiotherapy student could learn about fibromyalgia from the experts. And that was absolutely fascinating, and and a very different personal experience that's so much more reliable than say a textbook, for example.
Yeah, and I think within the disabled community, there are so many experts, and many times I've read accounts from people who've got not even conditions that are so rare, but perhaps they've been to 20 or 30 GP appointments before they've had the diagnosis that they feel is appropriate. We know that it's common to have about 5 appointments with with a GP before you get the correct diagnosis for an issue. But there's really standout cases where you think, well, everybody online who's got this condition is saying you're definitely one of us.
Yes.
So the fact that there are these fantastic sources of knowledge that are available to people, why can't we tap into those more as health professionals?
And I suppose they empower patients to then, or service users to go in and talk to professionals, and even if it's not exactly right, at least you can start that conversation. Because if you're saying, well, this isn't what you're experiencing, well, then there's something I have to explain that, like that, why they think that, or, no, I just think it will grow and grow, and actually by you getting more information out there means that the power of differential between patients and professionals will erode, because people will be on more of a level playing field.
Well, absolutely, and again, that's why I'm such a big advocate of social media. It's a flat hierarchy.
Yeah, absolutely.
In the same way, I was tweeting about conference a couple of years ago, and I started tweeting with somebody called Matthew.
Yes.
Oh, hello Matthew, have you been in OT long? Well, my name's Matthew Molyneux, and I've written a few books. It's like, oh my word, and Edward Duncan, he's tweeting regularly, he's the hackathon of our day.
Absolutely.
So it's a great way to connect, and I think it's fantastic. We've had a few of the talks where we've had Jackie Taylor from Salford came on once and did a question and answer. And said, of course, we would love to have you on.
Oh, right. Well, I'd be more than willing to do that.
To do a chat
about. I've just said that in public, haven't I? So you can hold me to it.
It's on the internet now.
That's the other thing, it holds you to account.
Yes.
No, I'd be delighted.
Well, that's great. And thank you very much, Dr. Bannigan, or Katrina, as I call you. Thank you very, very much for talking with us and explaining a little bit more about mental health OT and about evidence-based practice. If you ever do want to look up anything about evidence-based practice in mental health, I suggest doing a literature search for Dr. Katrina Bannigan, because if she hasn't written it, she's supervised the person writing it. So thanks very much for watching, and I will do another broadcast soon. Okay, bye then.